Hi everybody, I am Dr. Khyati Shah and I am an obstetrician and gynecologist. To tell you about me, I am a huge book nerd. I love reading books. So I thought let's tell you something about one of the books that I love and combine it with a topic that I am extremely passionate about, that is women's health and reproductive health. So the book I am talking about today is The Murder on Malabar Hill by Sujata Massey. This book's main protagonist is a female, Parveen Mistry. This book is set in the early 1900s and it's a huge deal because it combines two of my favorite genres, historical fiction and crime. So one of the parts in this book that really hit me the most was when Parveen gets her menses and she's asked to move into literally a 12 by 12 kholi, which is a very small, dark and gloomy room during her menses. She's supposed to do all her business there. She literally has to pee, poo over there. Also, for her menses, she's supposed to use a cloth. Now, that cloth literally has no means of getting dry because it's a dark room. So you can imagine it's very inconvenient, it smells, and it kind of is discrimination against women who are having their periods. In fact, one of the characters in the book had to go through the same ordeal and she actually ended up having a massive infection or what we call sepsis and passed away from the same. Now, what can we learn from this and what is the takeaway from all of this? Number one, to talk about menstrual hygiene, in my residency, I have seen so many people use cloths and not know basics. So this video is just an attempt of me to give you tips and tricks to do the same. Well, a few general ones to start you with the basics are, what is a normal menstrual cycle? So a normal menstrual cycle is something that comes every 21 to 35 days. There is a huge range. So girls, you don't need to panic if you are like late by 3-4 days. A cycle lasts normally for 2 to 7 days. And on each day, you should be using around 2 to 5 days max, 2 to 5 pads max. Basically, you should not be passing clots and you should not have the need to change your pad every 3 hours. If something like this is happening, you definitely should consult your local doctor. Okay, basic hygiene includes when you get your menses, you need to be adequately hydrated, meaning 2 to 3 liters of water daily, every day, compulsory. See, you're losing a lot of blood and you're going to feel dizzy, tired, irritated. The least you can do is hydrate yourself. Whenever you're using pads, please change your pads every 6 to 8 hours. You don't want that pad to stay there for long because blood can be a source for infection. Usually that pad can cause local skin irritation. Also, that can lead to genital tract infections as well. Whenever you're cleaning, please use warm water and don't use irritant or fragrant soaps. Your movements when you are cleaning should be from front to back and not vice versa. This is important to avoid infection which is around your anus to come towards your genital area. And lastly, if you have a lot of pain, you can use hot water bottles just to relieve your cramps. And also you can do basic yoga stretching exercises which will help you to release that dopamine, serotonin and literally help you with your cramps. Now in India, there are a lot of possible options for your periods. People use cloths, people use pads, tampons and menstrual cups. Now cloths, if you're using cloths, please dry it properly and then reuse it. A lot of people out of shame, out of issues with space, do not use dry cloths. So I would advise if you're using cloths, try to upgrade to a pad because it gives you more mobility and it's easier to dispose. But if there is not an option, at least use a dry, clean cloth and change the cloth every 8 hours. That is, at least you should use 3 cloths per day. If you're using a pad, I I said that you need to change it every 6 to 8 hours. And while you're disposing the pad, please wrap it in a newspaper and dispose it in the bin. Do not throw it here and there because it breeds a lot of infections and flies, and we are doing all of this so that you have less infections. If you're using a tampon, a tampon is something that you have to insert inside the vagina. If you're not comfortable, a pad is always an option. But if you're using a tampon, again, at least change the tampon every 8 hours. And if you're using a menstrual cup, great, because you're using something that can be reused again and it's fantastic for the environment. If you're using a menstrual cup, depending on your flow, at least every 12 hours, you need to remove it and clean the blood products. These are literally the basics, and maybe I'll get back to you with more book recommendations and definitely more tips and tricks on how to better manage your reproductive health. Bye.